I was pressing my hand against my chest, trying to ease the sharp pain that had been coming and going for weeks, when I heard my daughter Rebecca tell her sister on the phone that my chest pains were just attention-seeking behavior from a lonely old woman at 74 years old, with my late husband's medical insurance still covering me and a lifetime of putting everyone else's needs before my own. I thought I'd experienced every kind of dismissal a mother could face. I was wrong. What happened next would not only shock my family, but save my life in ways they never saw coming. But they forgot something important about quiet women from Florida who've survived hurricanes, raised ungrateful children, and learned to trust their own bodies when no one else will. The morning sun streamed through my kitchen window in Clearwater, casting long shadows across the breakfast table where I'd served countless meals to people who now questioned my every ache and pain. My chest felt tight again, that same crushing sensation that had been visiting me for 3 weeks now, always when I was stressed. Always when Rebecca and my son David were discussing my declining mental state in hushed tones they thought I couldn't hear. I could hear them in the living room of my own home, speaking in those clinical voices that medical professionals use when they think they know better than the patient. David worked as a pharmacy technician, and Rebecca was a dental hygienist, which apparently made them qualified to diagnose their 74-year-old mother-in-law from across the room. She's doing it again. Rebecca's voice carried that sharp edge of annoyance I'd learned to recognize, clutching her chest, making those little gasping sounds. It's textbook attention-seeking behavior. My psychology professor in dental school covered this extensively. I said nothing. I'd learned that silence was often the most powerful response to ignorance. I continued organizing my pill organizer. It's the same ritual I'd performed every Sunday morning for the past 5 years since Harold died. Each medication a reminder of a body that was aging, whether my family acknowledged it or not. "Mom's always been dramatic," David replied, and I could picture him shaking his head in that dismissive way he'd perfected since moving back in with me. 6 months ago, after losing his apartment, remember when she thought she had a stroke last year? It was just a headache. She went to the emergency room for a headache. Exactly, Rebecca agreed. And the time before that, when she was convinced she had pneumonia, the doctor said her lungs were completely clear. She's just lonely and looking for sympathy. The pain in my chest intensified, and I wondered if it was the physical discomfort or the emotional cruelty that hurt more. I pressed my hand against my sternum, feeling my heartbeat irregular and fast beneath my palm. This wasn't loneliness. This wasn't dramatics. This was something real, something urgent, something that felt like warning bells in a body that had carried me through 74 years of life. If you've ever felt dismissed by your own family when you knew something was wrong with your body, you're not alone. Please subscribe to hear more stories about women who trusted themselves when no one else would. These aren't just stories. They're reminders that our bodies speak truth even when our families refuse to listen. That afternoon, while they were out running errands and complaining about me to anyone who would listen, I sat in Harold's old recliner and made a decision that would change everything. I wasn't going to argue with them anymore. I wasn't going to defend my symptoms or justify my concerns. I was going to do something they hadn't expected from the quiet, compliant mother they thought they could manage. I was going to trust myself completely. I called my longtime physician, Dr. Martinez, who had been treating me for 15 years and knew my medical history better than I did. His receptionist recognized my voice immediately. "Mrs. Fitzgerald, how are you feeling today?" "I need to see Dr. Martinez as soon as possible," I said quietly. "I've been having chest pains for 3 weeks, and they're getting worse." "Chest pains?" Her voice became immediately alert. "Can you describe them?" "Sharp, crushing sensations. They come when I'm stressed or exerted. Sometimes they radiate down my left arm. Sometimes I feel dizzy and short of breath." "Mrs. Fitzgerald, I'm going to squeeze you in this afternoon at 3 o'clock. If the pain becomes severe before then, I want you to call 911 immediately. Do you understand?" I understood perfectly. I also understood that my family's medical expertise apparently didn't extend to recognizing classic symptoms of cardiac distress in elderly women. At Dr. Martinez's office, I described everything in detail. The crushing chest pain, the radiating discomfort, the shortness of breath, the irregularity I felt in my heartbeat. Dr. Martinez listened with the kind of focused attention I hadn't received from my family in months. "Margaret, I'm concerned about these symptoms," he said, his kind eyes serious behind wire-rimmed glasses. "I want to run some tests immediately, EKG blood work, and I'm scheduling you for a stress test tomorrow morning. My family thinks I'm being dramatic." I told him quietly. Dr. Martinez looked at me with the gravity of someone who had seen too many women dismissed and nearly lost because of it. "Margaret, in my experience, women your age don't imagine cardiac symptoms. They minimize them. The fact that you're reporting them this clearly tells me we need to take this very seriously." The EKG showed irregularities. The blood work revealed elevated cardiac enzymes. Dr. Martinez's expression grew increasingly grave as he reviewed the results. "Margaret, I'm admitting you to the hospital tonight for monitoring and further testing. These results suggest you may be experiencing what we call unstable angina, which can be a precursor to a heart attack." The words hit me like a physical blow. Heart attack. The thing my family had dismissed as attention-seeking was actually my heart crying out for help. "Should I call my family?" I asked. "Absolutely. They need to understand that this is a serious cardiac event. If this is making your blood boil, if you're feeling that righteous anger about medical dismissal of elderly women, hit that like button. Because our pain is real, our symptoms matter, and age doesn't make us liars about our own bodies." I called David from the hospital admissions desk, my voice calm despite the fear coursing through me. "David, I'm at Clearwater General Hospital. Dr. Martinez is admitting me for cardiac monitoring." Silence. "Then what, Mom? What are you talking about?" "It's the chest pains I've been having. They're related to my heart. Dr. Martinez says I'm at risk for a heart attack." More silence. I could hear Rebecca in the background asking what was wrong. "Mom, are you sure you're not overreacting? Maybe you should just come home and rest." "David, I am in a hospital bed. I have electrodes attached to my chest. My cardiac enzymes are elevated. This is not an overreaction. I'll be right there," he said finally, but I could hear the skepticism in his voice. They arrived 20 minutes later, Rebecca still wearing the expression of someone who believed she was enabling an elderly woman's dramatics. David looked uncomfortable, as if my being in a hospital bed was somehow an inconvenience to his narrative about my attention-seeking behavior. "Mom, you look fine," Rebecca said, the first words out of her mouth. "Are you sure this is really necessary?" Before I could answer, Dr. Martinez appeared with my test results. His expression was grave as he addressed all three of us. "Mrs. Fitzgerald is experiencing unstable angina. Her EKG shows significant abnormalities, and her cardiac enzymes indicate heart muscle stress. We're looking at a 70% blockage in her left anterior descending artery, which we call the widowmaker." The room fell completely silent. Without immediate intervention, Mrs. Fitzgerald could suffer a massive heart attack within days or weeks. "We need to schedule a cardiac catheterization immediately, possibly leading to angioplasty or stent placement." Rebecca's face went pale. David looked like he'd been slapped. "Are you saying ... double quotes," David started. "I'm saying your mother's symptoms were absolutely real, absolutely serious, and absolutely life-threatening. If she hadn't come in today, if she had continued to ignore these symptoms, or if they had been dismissed much longer, we could be looking at a very different outcome." I said nothing. I just watched my family absorb the reality that their attention-seeking mother had nearly died while they rolled their eyes at her dramatics. What I'm about to tell you next shocked everyone in that hospital room. Make sure you're subscribed and hit that notification bell. Because these stories of women trusting their instincts when everyone else fails them are exactly what the world needs to hear right now. The next morning, I underwent cardiac catheterization. Dr. Martinez inserted a tiny camera through an artery in my wrist and navigated it to my heart. On the monitor, we could all see the blockage, a massive obstruction in the artery that supplies blood to the front wall of my heart. Mrs. Fitzgerald, you can see right here. Dr. Martinez pointed to the screen. This blockage is severe. Your heart has been crying out for help, and those chest pains were your body's warning system working exactly as it should. They inserted 2 stents to open the blocked artery. The procedure took 2 hours, during which David and Rebecca sat in the waiting room, confronting the reality that they had dismissed a life-threatening medical emergency as emotional manipulation. When I woke up in recovery, the crushing chest pain was gone for the first time in weeks. I felt like I could breathe fully again, like my heart was finally getting the blood flow it desperately needed. David was the first to speak when I was fully awake. Mom, I'm so sorry. We should have listened to you. We thought ... double quotes Rebecca started, then stopped. I thought you were just... You thought I was a lonely old woman making up symptoms for attention, I finished for her. I know what you thought. Dr. Martinez arrived with my discharge instructions and a reality check that my family needed to hear. Mrs. Fitzgerald was hours or days away from a massive heart attack, he told them directly. The symptoms she described to you: chest pain, shortness of breath, arm pain. These are classic presentations of cardiac disease in women. Dismissing them could have been fatal. We didn't know, David said weakly. The not knowing isn't the problem, Dr. Martinez replied. It's the problem is dismissing her concerns without seeking medical evaluation. Mrs. Fitzgerald knows her body better than anyone else. When she tells you something is wrong, your job as family is to support her in getting proper medical care, not to decide for her whether her symptoms are real. Over the next week, as I recovered at home, my family transformed before my eyes. The dismissive comments stopped completely. When I mentioned any discomfort or concern, David immediately offered to drive me to the doctor. Rebecca researched cardiac rehabilitation programs and heart-healthy recipes. But something had fundamentally changed in our relationship. I had learned that I could trust my own body even when the people closest to me refused to. I had learned that my instincts about my health were not only valid but potentially life-saving. And I had learned that being called attention-seeking when you're actually dying is a form of medical gaslighting that nearly costs women their lives every single day. This is exactly why you should never let anyone dismiss your physical symptoms, especially as an older woman. If you know someone who's been told they're being dramatic about their health concerns, please share this video with them. 2 months after my stent placement, I was stronger than I'd been in years. My cardiologist cleared me for moderate exercise, and I joined a cardiac rehabilitation program where I met other women who had similar stories of family dismissal and near-death experiences. My daughter told me I was having anxiety attacks, shared Eleanor, a 68-year-old who had suffered a heart attack because her family convinced her not to go to the emergency room. My son said I was being a hypochondriac, added Patricia, 71, whose triple bypass surgery could have been avoided if someone had taken her chest pains seriously 6 months earlier. We were a group of women who had learned the hard way that trusting ourselves isn't selfish, it's survival. Rebecca approached me one evening while I was organizing my new cardiac medications, her expression humble in a way I'd never seen before. Mrs. Fitzgerald, I need to apologize more formally. She said, I was wrong about everything. My dental hygiene training doesn't qualify me to diagnose cardiac conditions. And my psychology elective certainly doesn't make me an expert on attention-seeking behavior. What changed your mind? I asked. Research. After your procedure, I looked up statistics on women and heart disease. Did you know that women are 7 times more likely than men to be misdiagnosed during a heart attack? That women's cardiac symptoms are dismissed as anxiety or attention-seeking at alarming rates? I hadn't known the exact statistics, but I had lived the reality. I also learned, she continued, that women often minimize their symptoms, not exaggerate them. You weren't being dramatic. If anything, you were probably downplaying how bad you felt. She was right. I had been downplaying the severity because I'd internalized their message that I was being attention-seeking. I had started to doubt my own experience of pain. Rebecca, I appreciate your apology. But more than that, I need you to understand that this isn't just about me. This is about how we treat older women in general when they report health concerns. I understand that now, she said quietly, and I'm ashamed of how we handled it. David joined us in the kitchen, carrying a folder full of papers. Mom, I've been doing research too. I found support groups for families of cardiac patients, and Rebecca and I want to attend with you if you're willing. I looked at both of them, these two people who had nearly cost me my life with their medical arrogance and who were now genuinely trying to make amends. I'm willing, I said. But I need you to understand something fundamental. My body belongs to me. My pain belongs to me. My symptoms belong to me. Your job isn't to decide whether they're real or valid. Your job is to support me in getting proper medical care. We understand, David said. Completely. 6 months later, my cardiologist pronounced my recovery remarkable. My heart function had improved significantly. My stamina was better than it had been in years. And most importantly, I had developed an unshakable trust in my own physical intuition. I also became a volunteer with the American Heart Association, speaking to groups about women's cardiac symptoms and the importance of self-advocacy. My story resonated particularly with older women who had experienced medical dismissal. Family told me I was imagining things too, confided Helen, 79, after one of my presentations. But you've given me permission to trust myself. That's exactly what I wanted, to give her permission to trust her own experience, her own body, her own instincts about what was happening inside her. Rebecca and David kept their word about changing how they responded to my health concerns. When I mentioned back pain 3 months later, David immediately scheduled me an appointment with my primary care physician. When I felt dizzy one morning, Rebecca drove me to urgent care without question or commentary. The back pain turned out to be nothing serious, and the dizziness was related to a medication adjustment. But their response was what mattered: immediate support for getting professional medical evaluation rather than family diagnosis and dismissal. If this story moved you, if it reminded you that your body's signals matter regardless of your age, please subscribe for more stories of women who trusted themselves when everyone else failed them. Share this with someone who needs to remember that their pain is real, their symptoms are valid, and their instincts about their own body are usually right. Looking back now, a year after my cardiac event, I realized that my family's dismissal of my chest pains wasn't just about medical ignorance. It was about a broader cultural tendency to dismiss older women's concerns as emotional rather than physical, attention-seeking rather than genuine, dramatics rather than distress. I learned that the phrase attention-seeking is often code for "we don't want to deal with your needs." I learned that when someone accuses you of being dramatic about your health, they're often revealing more about their own discomfort with aging and mortality than about your actual condition. Most importantly, I learned that my survival depended on trusting myself completely, even when, especially when the people closest to me, refused to trust me. My heart is strong now. My family is more supportive. But the most significant change is in my relationship with myself. I will never again doubt my own experience of physical distress. I will never again allow someone else's comfort to take priority over my safety. At 74 years old, I thought I had learned all the important lessons about family, trust, and survival. I was wrong about that too. But this time, being wrong led me to a truth that saved my life. Sometimes the most important person to believe in your pain is yourself. The chest pains were real. The cardiac blockage was real. The risk to my life was real. And my instinct to seek medical care, despite my family's dismissal, was the realest thing of all. Remember, your pain doesn't need anyone else's permission to be valid. Your symptoms don't require family approval to be serious. And your health doesn't need to meet anyone else's expectations to deserve proper medical attention. Trust yourself. Your life may depend on it, just like mine did.